Dr. Jory Simpson is a breast surgical oncologist. He teaches at the University of Toronto and joins us now from Toronto. Dr. Simpson, thank you. Such a great concern that those with cancer have as they've waited out COVID-19. What are you learning about the delays to needed surgeries for breast cancer?
Well, thank you very much for the invitation to join today. There definitely have been delays over the last 6-7 weeks with regards to cancer care. And this is one of the unfortunate collateral damages of a pandemic. We are doing our best, though, to prioritize certain types of cancers and perform their operations and make sure that they're not waiting.
Okay, and anxiety actually is we're reading a lot about cancer patients with anxiety. What does that help you move up in the queue if you cannot control your anxiety? What's going on about dealing with that?
Well, I wouldn't say, it's completely normal to have anxiety with regards to a new diagnosis of cancer. Add on the fact that it happened during a pandemic and there's some uncertainty around when you're going to have your surgery. What we're trying to do, though, is prioritize patients based on the type of cancer they have and what stage of cancer they are, and do their operation based on that. Now, to address some of the anxiety that patients are experiencing, we're doing our best to make sure that we're communicating with them regularly and easing some of that anxiety by just discussing the reality. The truth is that if a cancer was delayed, for example, in breast cancer, by 6 weeks or so to surgery, that really wouldn't have an impact on their ultimate survival. We know from previous studies that, in fact, you could wait even a couple months before you start seeing a change in the stage of their breast cancer, which ultimately would change their survival. So I think it's really important to discuss this with our patients at this time and provide some reassurance that a wait or a delay of even up to 2 months would not ultimately change how well they're going to do from their type of cancer when we're specifically speaking about breast cancer.
Okay, so there's that assurance that we do have a little breathing room. But what would you say to those that are just very worried about the unpredictable nature of their cancer in this pandemic, and we're feeling like maybe we're going to be able to start scheduling surgeries again?
So hopefully very soon we are going to be able to start scheduling surgeries again. Now, we've also still been operating on patients who have had breast cancer. It has not been a complete shutdown. So we've just been prioritizing patients. So to give you an example, let's say you had a patient that had just finished chemotherapy and she had to have her surgery done within a certain time frame. We would have prioritized her and she would have had her operation in the second half of March or the first half of April. So based on where you are in your treatment cycle, we have been operating on patients.
Well, it's a communication battlefield then, isn't it? Thank you very much for trying to stay on the front line there in cancer care. Thank you, Dr. Jory Simpson.
Thank you for having me.
Hit subscribe and the notification bell to get our weekly episodes and web exclusives.